Presiding Officer, I want to just remind everyone I'm a member, or the board member of Moving On Inverclyde, a local addictions service. This is very much an important debate, and I do welcome the opportunity to speak on it. I also welcome the appointment of a Minister for Drugs Policy. I did actually write to the First Minister asking for a dedicated minister in this field. I was asking for that to happen for the next parliamentary session, but I'm certainly pleased that Angela Constance has got that role, certainly for the remainder of this session and hopefully beyond. Almost 3,400 people in Scotland have lost their lives due to drug misuse in the last 3 years, including 80 who lived in Inverclyde. And each one of these deaths is very much a tragedy, and I do offer my condolences to the family, friends and loved ones of those who have lost their lives. But a number of the drug-related deaths in Scotland the number is very much simply unacceptable, and which is why I did welcome and very much do welcome the First Minister's declaration of a national mission to tackle the crisis that is blighting our communities, and some sadly more than others. The additional funding of £250 million over the next parliamentary session is very much welcome, and the additional £5 million made available immediately to ensure priority work gets underway as quickly as possible shows, however, that this new Minister and the Scottish Government are committed to provide that national mission with the leadership, focus and also resources that it needs to really turn this situation round to save lives. And as a member of Moving On Inverclyde, I know firsthand the vital role that the third sector organisations play in supporting people living with drug addiction. And we just heard comments from Ruth Maguire a moment ago, and I genuinely welcome the Scottish Government's commitment to actually work across the health and care sector to ensure that no door is the wrong door to help and support. Tackling the crisis also means putting our efforts into improving mental health support, reducing homelessness and ensuring we have a humane and responsive justice system. The statutory services have a hugely important role in keeping people alive, but they can be limited in what they can provide for wider needs. And the third sector, therefore, they can assist in meeting service users' other needs and helping them to progress through their recovery. And direct funding to the third sector organisations from the Scottish Government would generally be the most welcome thing the Government could do to actually allow these services to focus on planning and also the delivering of the services that people need. And I've spoken about the third sector in debates about drugs before, which Mr Whittle, he was certainly in those debates. So I genuinely am pleased about the announcement today of the 4 new funds to help certainly in this regard. Presiding Officer, I do welcome that some of the immediate actions the Scottish Government are taking, including making heroin-assisted treatment services more widely accessible across the country. The work to increase the numbers in treatment, the rapid implementation of the recently developed treatment standards, the open additional residential rehabilitation placements, and also the extend outreach initiatives that identify those who are at risk, address immediate health concerns and connect them with other community or clinical services. But, Presiding Officer, there are 3 key aspects to moving forward. First is the partnership working. Second is the evidence-based solutions. And thirdly, listening and acting on people with lived experiences. We need, every single politician, everyone in this Parliament needs to ensure that we push ourselves and challenge ourselves and society to make the changes required and to save lives. If we don't do this, we will fail many more people, many more families and many more communities. Thank you.